Today I'm going to chat with you a little bit about how I assess patients for eyelid rejuvenation. Hi, I'm Dr. Victoria M.A. I'm a plastic surgeon in Scottsdale, Arizona. So there are a few things I look for when patients come in for a consultation. Typically, patients will feel like their eyelids are saggy, but that can actually be caused by a couple of things. And so during our assessment, I'm going to be looking at those things. So number one, sometimes the eyebrow will sit a little low. Actually can be kind of flat. And as we age, this outer part of the eyebrow or even the center can come down a little bit. And that can make people look tired, angry, things like that. So one option would be an eyebrow lift. And basically what we're doing is we're just opening up that space, giving you more of an arch, giving you more skin or real estate, if you will, between your eyebrow and your eyelid margin. That's an eyebrow lift. That's one option. Sometimes when patients have a really low set eyebrow or really heavy hooded eyes, they will also try really hard to hike up their eyebrows so that they don't have so much weight and they can see better. Sometimes they'll have some wrinkles on their forehead just from trying to pull that eyebrow or that eyelid skin up. So that's one thing. The next thing I look for, kind of working our way down, is how much extra skin you have on your upper eyelid. So a lot of times patients will say, I have this hooded skin, saggy skin, it makes me look tired, it creases with my makeup, sits on my eyelashes, things like that. So that skin can develop. Think about how many times you blink over all the years of your life. That skin will constantly stretch out and age with time and can get kind of floppy and redundant over time. So we can actually take off that extra skin, and if a little eye fat bag develops over here that pooches out, we can cut that out at the same time. That's an eyelid lift or an upper blepharoplasty. Now the third thing I look for is something called ptosis. So ptosis is where your eyelid margin actually comes down and sits low. It can actually cover up your pupil and become difficult to see out of, especially as the day goes by and patients get tired. It can be on one side or both sides. And so a lot of times if you look at the eyelids, it's only on one side that the eyelid is lower. But that can affect both eyelids, especially if it happens with age. And this is caused by the eyelid muscle called the levator getting stretched out or not working as well as it used to or as it should. So that helps open up the eyelid, and when it doesn't work as well, the eyelid sits too low. So we actually have to go in there and raise up that eyelid, tighten it up so that the eyelids sit pretty close together. So that's called a ptosis repair. A ptosis repair can be done at the same time as these other procedures, but an eyelid lift and an eyebrow lift will not fix a ptosis. So it's very important that if you have a ptosis, that is fixed instead of just trying to fix it with these other procedures that don't quite address it. So those are the three things I look for. It's really important to have a consultation and figure out what procedure works best for you and what you actually need to achieve your goals. If you have any questions about that, I'm happy to answer them. Feel free to drop them below.